Hello, Namaskar. I am Dr. Sagar Javle, a doctor turned into a scientist, and in this today's video, we are going to discuss about transcutaneous electrical nerve stimulation, a relatively new therapy which is used particularly for various pain disorders. So we are going to discuss the various aspects of that. Please subscribe to this channel, press the bell icon button, like button, and make this video viral to all the patients who have chronic pain. So as far as the introduction is concerned, uh, the chronic pain is a major issue all across the world, and millions of patients are suffering from chronic pain at various parts of the body. And then there is a drug treatment for that in the form of non-steroidal anti-inflammatory drugs or steroidal inflammatory drugs. Now, if you take these drugs only for a few days, it is perfectly all right. But when you take these drugs for a long time, such as weeks, months, and particularly years, then they have tremendous side effects. And the side effects are serious, and they can lead to your kidney failure or liver failure, and that is why it is not acceptable for the long run. That is why we must find out alternatives to the chronic pain management by therapies which have very little to no side effects and similarly no cost, and which have a long lasting effects. Like the drugs, moment you stop, the pain comes back again, whereas in this therapy it has a longer duration of action, so for many days or weeks the pain may not come back. So these are the advantages of this therapy over the conventional drug therapy. So that is generally an introduction of what is this TENS about. In this TENS, also known as transcutaneous electrical nerve stimulation, electrodes are placed around the nerve or over the nerve or on the area of the pain, and electrical impulses are fired so that the pain is reduced or gone. So that is the basics. We will discuss the details further. Now, what are the indications? What are the diseases for which this therapy is used? So basically we have musculoskeletal pain in the form of low back pain, acute and chronic, neck pain, osteoarthritis of the knee and the hand, rheumatoid osteoarthritis, fibromyalgia, tendinitis, bursitis, myofascial pain syndrome. So these are the musculoskeletal indications. Then we have the neuropathic pain indications such as diabetic neuropathy. Millions of patients have diabetic neuropathy, and the pain is so horrible that throughout the night there is pricking pain sensation. You are not able to sleep. So post herpes neuralgia, phantom limb syndrome, and complex region pain syndrome, these are some of the other indications. Then you have post-operative pain, obstetric pain, so labor pain management, and other pain conditions such as dysmenorrhea, so the menstrual pain, headaches, migraines, trigeminal neuralgia. So these are the various disease conditions and vast disease conditions where TENS can be used. Now, what is the mechanism of action? How this particular therapy works? There are theories about it. The first theory is the gate control theory of pain, which states that whenever you run impulses over the nerve, it goes to the spinal cord. There is a center called the gate, and that gate blocks the pain so that the pain is present but you don't feel that. So this is the gate control theory. I am stating in very short because we are the audience is generally lay people and not qualified doctors. The second theory is a opioid release theory, which states that body produces its own painkillers called opioids, uh, which block the pain. So they are released. That is another theory. Then there is an improved circulation of blood. Then there is a muscle relaxation, reduction of edema, and sometimes some placebo effect, means psychological effect is also there, some 20 to 30% cases. And these are the mechanisms by which the patient feels that the pain is either reduced or gone. Okay, and now we will see where is the exact location of the electrodes that you should put. So the location is generally over the nerve, around the nerve or over the nerve. That is one very important. Second is dermatomes, means uh, what are the areas supplied by the nerve. That area uh, is known as dermatomes. So over the dermatomes it can be placed. Then it can be over acupuncture and acupressure and trigger points. So these are the locations there you are supposed to put the electrodes. So how you are supposed to put? First, clean the skin with antiseptics, remove any hair if it is there. Okay, then the electrodes have to be placed in a non-hairy area or remove the hairs. Avoid around the eyes or around the important nerves or around the neck. And as per the particular disease, I will make specific videos and diagrams where you will be specifically told where to put the electrodes. So this is a general introductory video, so we don't go into details of that. Then what are the types of the TENS? Is a low frequency TENS, which is about 1 to 10 hertz frequency can be kept. High frequency TENS where 80 to 150 hertz can be kept. Then there is a burst mode where it bursts tiny electrical impulses over the particular area. So there are three types of the TENS. What is the duration? Usually 30 minutes. 30 to 90 minutes, but usually 30 minutes, once a day or twice a week for 6 weeks, and then as and when necessary. So what are the results? Results usually come within first week itself. The results are in the form of reduced pain sensation and reduced amount of the drugs, and some lucky people may be able to get away with the drugs altogether. So that's how the results come. And some patients may get away with some patients may relieve the pain altogether, and some patients will require for 2 to 3 weeks and they will go into remission, means it is cured for the timing at least. Other patients, the pain keeps coming, then that's why there is a maintenance of once or twice a week, could be for 1 or 2 years or for the rest of your life. So although you have to take it for a very long time, the cost per session is practically zero because electricity required is negligible. Machine cost you have to pay only once. Okay, so it is far superior than the drug treatment, far more effective also, and that's why the doses of the drugs can be reduced or the drugs may not be necessary at all. So that is the beauty of this particular therapy. Then what are the side effects? The side effects are minor. None of the side effects are serious. They are far less than the drug treatment. The therapy will never destroy your kidney or liver like the drugs do. And there can be minor skin irritation at the place of the electrode. There can be burning during treatment. There can be skin irritation or skin allergy, which goes away by itself or just by putting some regular ointment like calendula or whatever. anti-inflammatory ointment, it disappears. And apart from that, there are no side effects. Then who are the patients who should not try it? Generally, we don't advise in pregnancy. Actually, nothing will happen, but if there is abortion, the woman may wrongly claim that it is because of the device. Okay, so in pregnancy, then in epilepsy patients around the head area, it should not be tried. Other areas, epilepsy patients can also try. And in other patients who have cardiac pacemakers put inside, they should not use it because the tense impulses may interfere with that. Then deep vein thrombosis and active bleeding or hemorrhagic disorders are some of the rare conditions in which this particular modality may not be used. So as I think we have discussed in detail what is stents, what are its indications and what are the types. Now there are I am supplying two types of machines for this. One is a basic machine and another is the advanced machine. Both the machines have two channels, and but the difference of cost is that the advanced machine costs double of the regular machine. So two machines are present. You can buy any of those. So the demonstration of the machine is will be a separate video. It will be posted. It is already posted on the website. You can see that. So I think we have discussed enough in this video about the various aspects of TENS, and the therapy is certainly superior to the conventional in the form of far less side effects, far less cost. It is specific because you have just pain in a particular area. You are taking a pill and the drug is going in all parts of the body unnecessarily, isn't it? So you have back pain and just 1 inch area of pain, and you are exposing the whole body to the drug and the side effects, so it is not worth it. So drugs can never act locally in a particular area. When taken orally or injection, they go all across the body, leading to side effects, so that is not acceptable. So that is the benefit. Second is the cost. Cost is negligible. You have to pay only once and then there is no cost. Then the body produces its own drug upon stimulating the nerves. The nerves also produce a nerve growth factor and brain derived neutropic factor, and that repairs the nerve like no medicine in history can repair. So that is locally produced by the nervous tissue. So that is also one of the mechanism of action. So I think we have discussed sufficiently about TENS and what are its implications in healthcare. Please make this video viral, send it to all the patients of the pain so that they are benefited. In the description box below, I am giving you the links for the buying the device, as well as the other literature and links which are necessary for you to understand about what is this TENS all about. So and my personal contact number is also present. My website, my WhatsApp number is there. So if you have not understood anything despite watching the video, then only you can contact me. Otherwise, please don't misuse it. Is my personal number. Thank you very much.